Good morning, students, and this is the explanation of the chapter 35 PowerPoint, which I posted on web access. And this would be actually my third video um, in the series of cardiac e-lectures. I already posted the right-sided heart failure and left-sided heart failure e-lecture on the YouTube. Now, for the purpose of exam and also, you know, for NCLEX, you should be knowing at least basic information about the anatomy and physiology of the heart. Um, you have heard this many times that heart is a four-chamber organ, and it's a hollow organ. It's a hollow muscular organ. It's a muscle, and it's normally the size of a fist. It is situated within your thorax in the mediastinal space that separates the right and left pleural cavities. Now, three layers of tissue, they form the heart wall. The outer layer of the heart wall is known as the epicardium. The middle layer is the myocardium, and the inner layer is the endocardium. Now make sure you don't get confused. There are three layers of tissue which form the heart wall, and the outer layer of the heart wall or this tissue is called epicardium. The middle layer is called the myocardium, and the inner layer is called the endocardium. Now the heart is covered by a fibroserous sac which is called the pericardium. This sac also has two layers, the inside layer, which is also known as visceral layer, and the outside layer, which is also known as parietal layer. There is a small amount of pericardial fluid between the two layers, the visceral and parietal, which helps in lubricating the space, and it helps in preventing friction between the surfaces of the heart as the heart contracts. The heart is divided vertically by the septum. Now, the interatrial septum, it creates a right and left atrium, and the interventricular septum, it creates a right and left ventricle. Now, the thickness of the wall of each chamber of the heart will be different, and the atrial myocardium is thinner than that of the ventricular, and the left ventricle wall is 2 to 3 times thicker than the right ventricular wall, and I don't need to explain it to you why left ventricular wall is more thicker. While it's um, I have while we discussed about the blood flow through the heart many times in class, it is very important for you to know that both atria and ventricles, they contract at the same time. Heart is a big muscle, and there are some lot of simultaneous activities happening. The heart works as two pumps. There are one pump on the right and one pump on the left, and they are all working simultaneously. Blood flows from the right atrium to the right ventricle and then is pumped to the lungs to receive oxygen. From the lungs, the blood flows to the left atrium, then to the left ventricle. From there, it is pumped to the systemic circulation. So this is the basic information you should know about the blood flow through the heart. So let's go to the next slide. Cardiac valves. By this time, I'm sure all of you know what are the name of the cardiac valves. Now, as I said, the heart is a big pump. It needs a set of valves to keep the fluid flowing in one direction. Okay, and that is forward direction. And the heart has two types of valves that keeps the blood flowing into the correct directions. The valves between the atria and ventricles are called AV valves, or atrioventricular valves, or cuspid valves. And those valves which are at the bases of the large vessels in the heart, leaving the ventricles, are called the semilunar valves. The right atrioventricular valve is the tricuspid valve. The left atrioventricular valve is the bicuspid or mitral valve. The valve between the right ventricle and pulmonary trunk is the pulmonary semilunar valve. The valve between the left ventricle and the aorta is the aortic semilunar valve. When the ventricles contract, the AV valves close to prevent the blood from flowing back into the atria. And this is what should happen normally. And usually due to some disorder, disease, or damage, the prevention of blood flowing back into the atria doesn't happen, and the blood starts going backward. When the ventricles relax, the semilunar valves they close to prevent blood from flowing back into the ventricles. So again, their heart has two types of valves, and they keep the blood flowing in one direction, in the forward direction. The valves between the atria and ventricles are called AV valves or cuspid valves, while those at the bases of the large vessels leaving the ventricles are called semilunar valves. The right AV valve is the tricuspid valve. The left AV valve is the bicuspid or mitral valve. The valve between the right ventricle and pulmonary trunk is the pulmonary semilunar valve. The valve between the left ventricle and the aorta is the aortic semilunar valve. Now, when the ventricles contract, the AV valves close to prevent blood from flowing back into the atria. When the ventricles relax, the semilunar valves close to prevent blood from flowing back into the ventricles. Okay, so um, just remember how these four valves help in the forward flow of the blood and how these valves prevent the blood going back into the atria or the ventricles. Okay, let's go to the next slides. Now we are coming to the coronary arteries and veins. Now the myocardium of the heart wall, the tissue of the heart wall or the tissue of the heart wall is a working muscle, and it needs a continuous supply of oxygen and nutrients so that it can function efficiently. For this reason, cardiac muscle has an extensive network of blood vessels, which is coronaries, arteries, and veins to bring oxygen to the contracting cells and to remove all the waste products. The myocardium or the heart tissue or the heart muscle has its own blood supply, the coronary circulation. Blood flows into the two major coronary arteries, and the blood flow into the two major coronary arteries occurs mainly during diastole, which is relaxation of the myocardium. The left coronary artery is coming out from the aorta, and then it divides into two main branches, the left anterior descending artery and the left circumflex artery. I will repeat this. The blood flow into the two major coronary arteries, it happens mainly during diastole, which is we all know is relaxation of the myocardium. Then the left coronary artery, it arises from the aorta and divides into two main branches, which is left anterior descending artery and the left circumflex artery. These arteries supply the left atrium, the left ventricle, the interventricular septum, and portion of the right ventricle. So the left coronary artery, which divides into two branches, left anterior descending artery and the left circumflex arteries. These arteries, they supply left atrium, left ventricle, the interventricular septum, and portion of the right ventricle. The right coronary artery also arises from the aorta. So the left coronary artery is coming from aorta. The right coronary artery also arises from aorta or aorta, and its branches supply the right atrium, the right ventricle, and portion of the back wall of the left ventricle or the posterior wall of the left ventricle. Through research, it has been found that in 90% of people, the AV node, that is atrioventricular node, and bundle of His, which is part of the cardiac conduction system, they receive blood supply mainly from the right coronary artery. For this reason only, obstruction of right coronary artery often causes serious defects in cardiac conduction or rhythm. The divisions of coronary veins, they are as parallel to the division of coronary arteries. So most of the blood from the coronary system, it will drain, most of the blood from the coronary system will drain into a thing called, through a structure called coronary sinus, which is a very large channel, and which empties into the right atrium near the entrance to the inferior vena cava. Okay, so regarding coronary arteries and veins, you need to know there are two main arteries, left coronary artery and right coronary artery, and what structure left coronary artery supplies and what structure right coronary artery supplies. Because what will happen is we will know when these arteries get clogged, blocked due to different cardiac diseases or coronary artery diseases, and how the blood flow is obstructed. So that's why it's very important to understand how the heart is made, so, and what problem with what structure can give problem to the function of this big pump in our life, which is heart. Let's go to the next slide. The conduction system. Now I know when I talk about conduction system, and this will include the heart's electrical conduction, electrical activity. Some of you, or I should say, uh, most of you will get kind of, you know, and anxious or hyper, what it involves. We have to memorize everything? Um, I just saw a student yesterday with piles and piles of written notes, and she was still not able to, comprehend or retain everything and do, well in exam as she expected. The reason is, um, it's very important as nursing students for you to understand what's happening with anatomy and understand the physiology associated with it before you can even start thinking of any diseases or disorders. And this is where you don't need to memorize everything, you need to understand everything, and you can understand everything by listening to my lectures with various repetitions, reading from the book. So repetitions will make you remember, but don't memorize. Okay, so let's begin. This is the heart conduction system, and it has several components. The first part of the heart conduction system is the sinoatrial node, SA node, and it is also popularly known as pacemaker of the heart. Without any uh, neural stimulation, uh, the SA node will will start a rhythm, electrical conducting rhythm of the heart impulses from 70 to 80 times per minute. Because it establishes the basic rhythm of the heartbeat, that's why it's also called the pacemaker of the heart. Other parts of the conduction system are AV node, AV bundle, bundle branches, and conduction myofibers. Uh, In broad basic terms, the conduction system is a specialized nerve tissue responsible for creating and transporting the electrical impulse or action potential within a heart. Uh, this impulse starts the depolarization and subsequently the cardiac conduction. Um, I'm not going to explain you depolarization. Look in the terminology in the back of the book, or you uh, get familiar yourself with some of the medical terminology, which by this time you should have. So look the meaning of depolarization. So this impulse, the action potential, or the conduction system, this um, starts the depolarization of the heart and subsequently the cardiac contraction. The electrical impulse is normally started by the SA node, which is the pacemaker of the heart, which starts, so you see in this diagram, it's starting from the top. And each impulse which is coming from the SA node, it travels through the interatrial pathways to depolarize the atria, resulting in contraction. Then the electrical impulse travels from the atria to the AV node through internodal pathways. The the excitation, the electrical excitation, then it moves through the bundle of His and then through the left and right bundle branches. The left bundle branch has two parts, which is anterior and posterior. Then the action potential moves through the walls of both ventricles by means of Purkinje fibers. The ventricular conduction system delivers the electrical impulse within 0.12 second, and this triggers a very harmonious, a very synchronized right and left ventricular contraction. The result of the cardiac cycle is the ejection of blood into the pulmonary and systemic circulation. It ends with repolarization when the contractile fiber cells in the heart and the conduction pathway uh, starts again with the same cycle. Now this conduction system, for this slide, I would expect you to know how the electrical impulse carries from what part to what part, from SA node to AV node, then bundle of His, then Purkinje fibers, and how it's going in the ventricles. So this the sequence, that's what I would expect from you to know. Okay, let's go to the next slide. Electrocardiogram. Electrocardiogram, the let's go back. Whatever we learned in the conduction system, how the electrical activity is going on, or how the flow of cardiac impulse is being generated within the heart. Now man has created something called electrocardiogram, and this will detect the electrical activity of the heart on a piece of paper. And how it can be done exactly, the electrical activity of the heart can be detected on the body surface using electrodes, and it is recorded as an ECG. ECG. Okay. And the letters P, Q, R, S, T, and U, they are used to identify the separate waveforms which are occurring on the paper. The first wave, P, as you see in your slide, which is kind of um, green in color, the light green color. The first P wave, it begins with the firing of the SA node, and it represents the depolarization of the atria. So P is atrial depolarization, and it shows you the firing that the cardiac impulse has fired from the SA node. Again, you come and you go to the QRS. QRS complex. It represents depolarization from the AV node throughout the ventricles. Impulse transmission through the AV node uh, uh, let's start this again. The letters P, Q, R, S, T, and U, they are used to identify the separate waveforms. The first wave, P, it begins with the firing of the SA node, and it represents depolarization of the atria. Then we have something QRS. QRS complex. It represents depolarization from the AV node through the ventricles. Now, impulse transmission through the AV node is delayed for some time, and which accounts for some time interval between the end of P wave and the beginning of the QRS wave. And on the slide, you can see it as the um, small yellow sign. You saw a small yellow or orange sign. So, and the QRS complex is represents depolarization from the AV node throughout the ventricles, and impulse transmission through the AV node is delayed for some time, which accounts for the time interval between the end of the P wave and the beginning of the QRS wave. The T wave will represent repolarization of the ventricles. The U wave, if seen, may represent the U wave is not necessarily will be there, but if it comes on the paper U wave, it is seen, or it says it may represent the repolarization of the Purkinje fibers, or it may be associated with hypokalemia. So if somebody has low potassium, the U wave will be seen. Now, intervals between these waves, PR, QRS, and QT intervals reflect the length of time it takes for the impulse to travel from one area of the heart to another. Uh, Now, it takes the time for the impulse to travel from one area of the heart to the another. Now, these time intervals can be measured, and changes from these time references often indicate the kind of disease or problem the cardiac conduction system in a certain patient might be going through. So this is how the basic information about PQRST. So um, let's go to the next slide. We have done a lot of things. We have discussed systole and diastole in a so we have discussed this many times. Systole, diastole, and stroke volume. Systole is contraction of myocardium. Diastole is relaxation of myocardium, and stroke volume is amount of blood ejected with each heartbeat. Let's go to the next slide. This is mechanical system, cardiac output. uh, Amount of blood which is pumped by each ventricles in 1 minute, and usually for adults at rest it's normally from 4 to 8 liters per minute. Next, go to the next slide. Preload contractility after load. I'm not going to explain this in detail because I already explained this in the next um, in the earlier slides, in the heart failure slide, so I'm not going to go through this in detail. Let's go to the next slide. Okay, this is a question. A patient is receiving a drug that decreases after load. To evaluate the patient's response to this drug, what is the most important for the nurse to assess? Uh, so the options are heart rate, lung sounds, blood pressure, and JVD. Now, always remember, afterload is affected by size of the ventricles, the heart wall tension, and the arterial blood pressure. So the answer will be C, blood pressure. Okay. So decrease of afterload has to do with blood pressure, because afterload is affected by size of the afterload is affected by three factors: size of the ventricle, wall tension, and arterial blood pressure. Okay. So I'm stopping it here, and then I will go to the vascular system in the next slide, and that will be in the next recording.